There's a large movement, and this has happened in the US and it's starting to really creep globally, and that is to think about how do we develop a smart hospital concept. Now, we know that we're shifting care from the hospital outside the hospital. We also know that hospitals are the place and will continue to be the place where the most sick and acute patients go. So if your sickest and most medically complex patients are in the hospital, we're absolutely seeing more and more technology deployed in the hospitals that help us. And that means the concept of the smart hospital, it helps us with things such as how do we use Bluetooth low energy or RFID to know where every patient and every staff member is all day long. So we know how we need to staff our hospitals. We know if our patients are now in the OR, are they now in the recovery room? Are they in the emergency department? Are they moving from one unit to the other? So there is an awful lot that this can tell us. We also know that even today, we have the ability for employees to walk through a door and it swipes them in and begins their clocking their hours. When they walk out the door, it clocks them out and stops paying them for that day. We also know that we can put patients on monitors, and through the use of BLE or wireless, we can actually monitor patients wherever they are in the hospital. This means that we don't have to continually take them on and off monitors anymore. Think about the time that that saves our clinicians. Now, hybrid care is something that is growing by leaps and bounds. We are seeing this really expand pretty dramatically in the United States. In fact, we know 75% of hospitals are exploring virtual care for their inpatients. So we're seeing this grow pretty crazy. In Europe, I am aware that it is beginning to show up, but it is much slower in terms of the adoption on that. Now, this is the utilization of a hybrid care model. That means that you have direct care nurses that are touching the patients and interfacing with the patients. And then you also have a virtual nurse. Now, this isn't only nurses. If you think about this, literally every discipline is doing virtual care and has a model. We are seeing virtual respiratory therapists, virtual case managers, virtual pharmacists, virtual physicians. We are seeing all of it. And the goal behind this is how do we continue to provide safe and effective care at a lower price point to more people? So there is a lot of interest in expanding this care model. Now, I am often asked when you have cameras in the patient room, what does a camera see? Isn't that a privacy violation? And it's fascinating because the cameras, when we utilize the AI based cameras, what it sees is a computer image. And that means that it doesn't look exactly like you and I would look here on Zoom, but actually it looks different. It's what does the computer see? And that could literally be a bunch of dots that are connected. It could be an image that the computer sees as a patient, or it could be something else entirely. But it's not what you and I would look at when we're having a Zoom interaction. And why this is important is that we often have conversations with clinical staff around their concern of privacy when this is looking at patients in their rooms. And you can see, yes, we can tell it's a patient, and we also can tell we don't get all of the details on that, but rather it still allows us to do a good job providing safe patient care. And it can be much more effective because it gives us more eyes and ears to keep our eye on what's happening with each patient. Now, let's talk a little bit about service robots. Service robots are popping up everywhere. We're seeing them in this example, you're actually seeing service robots that are available to be utilized as security guards. So they can be deployed in parking garages or buildings during the night shift. So when we don't have enough security guards, we absolutely can use robots. We're also seeing service robots that can help us do hunting and gathering to get equipment and supplies for patients on their units and bring it to the nurses. So service robots is something that is growing as well. Now, this is kind of cool. Let's talk for a minute about clinical tools. From a clinician perspective, we know that we spend a tremendous amount of time documenting. We also can use some of the, what I'm going to say, the more old-fashioned tools that are out there, like a small earpiece, where not only can physicians dictate, nurses can dictate. Yet take this to the next level, and we know that rooms that are wired with cameras or speakers and microphones, you don't even need to wear an earpiece. You literally can utilize that ambient computer sound in those sensors to dictate your note, whether you're a physician or a nurse practitioner or a midwife, or even if you're a nurse. So we need to think about, how do we train our workforce to provide good notes, not rambling on with a note that's a paragraph long, but what's the really clear and succinct stuff that we have to convey? And then how do we use AI to shape that into a really meaningful note that's documented in our patient record? This middle picture is kind of cool, and these are glasses that are thermal glasses. So they're intended for wound care patients, and it allows the clinician to wear them. And they also can snap a picture. That picture can be sent wirelessly to a physician or a provider for a consultation. It also could be uploaded in the patient's health record. So there's a lot of ways that we can use this to convey really important information, to get a second opinion, to get a consult, to get a set of orders, to help us provide better care for our patients. You could use this on home visits. You could use this when you are out in public health, out in the community, seeing patients with wounds. It really helps us to bring care to where our patients are instead of requiring the patients to come to us. Now, this other device that's over on the right, this is called an echo stethoscope. This is about $500. And what this allows us to do, it's Bluetooth, it's wireless, and it's noise canceling. And what you see there on that phone is that when you are listening through your echo, it actually visualizes what you're hearing. It's an incredible way to teach nursing students, medical students, respiratory therapy students about what they're hearing. So they now can actually visualize it and understand what that looks like so they can get really good and dial in at those sounds. The other thing this can do is you actually can clip an MP4 file of what you hear, and you can send it to a consultant. You can send it for a second opinion to have someone else listen to it. You also can create a snip of that MP4 and drop it into the electronic health record. So the sound is actually saved in your electronic health record. So really amazing things that we're able to do with this technology. Now, while we look at all the cool technology toys, it's important to think about care. And care models are changing. We are moving from sick care to more continuous health care that's virtual and personalized. And what's important about that is that the more we utilize technology and AI to enhance our care, the more it allows us to bring down the price point of care delivery and also to bring care to more people. So technology isn't something that we should push back or push away or shy away from, but rather let's think about, how do we sensibly adopt it in the areas that we need, so that we can also think about putting this in place in ways to improve the care of our communities. Now, one of those ways we can improve care is thinking about, where is care provided? How do we know when care is appropriate for the home or the community? How do we know when care really gets to the point of having to occur in a hospital or medical center? Now, there are different models of care that are evolving here in the United States that allow us to bring significant resources to a patient's home, to even provide urgent care, to determine, are they a patient that needs to go to the hospital for an admission, or can we create a hospital at home type admission and actually care for them with remote patient monitoring in their own home? Or is this now a patient that truly does have to go to the hospital? Certainly in the United States, we have a very, very expensive healthcare system. So sending a patient to the hospital for care is the most expensive way that we provide care. We really are trying to keep patients out of the hospital. To do that, we need more technology to assist us. And that's where we start to look at remote patient monitoring. This is the ability for us to monitor patients remotely and in their homes. That means utilizing different tools to help gather vital signs, glucose readings, temperatures, blood pressures, weights. Think about how this could benefit you with your CHF patients if we could have them weigh every day and then their weight is actually automatically documented in their EHR. Think about how you could use artificial intelligence to analyze those weights over a week or over a month to then identify patients that actually need more intervention. This is how we begin to bridge all these pieces together. We're using the monitoring devices to collect the information. We're utilizing AI to synthesize and analyze. And then we're using our human beings to identify the patients that really need that care so we can interact with them either virtually or potentially bringing them into the physician's office or to our practice or admitting them to our hospitals. So when you think about how we bridge all these pieces together, that's really where we're going from a care perspective. Now, we also know that the wearables market and the sensors, this continues to grow and proliferate. And there is some amazing technology out there that is very, very helpful for where we want to go today. And if you look at this slide with me, up on the upper left, you actually see a Dexcom, which is now very, very common. And that gives us the ability to provide patients with continuous access to their blood glucose monitoring. It's an incredible way for patients to do a far better job with glycemic control. And if you look over on the top right, you're actually going to see this is an insulin pump that interfaces with the Dexcom on your phone. So think about when you have a reading that's high and you need insulin, now your insulin pump is automatically triggered and providing you with insulin. And we can track all of that, your glucose and your glycemic monitoring, your insulin delivery, and we can either download a report or all of this can interface with your EHR. With the appropriate artificial intelligence analytics, we actually can look at that and start to assess patterns and trends to see, is there something we need to change? Is there a medication that you're taking we need to adjust? Have you gained or lost weight that now is impacting your care? So these technologies are incredible. If you look at the bottom here in the middle, you'll see this is an example. This is a ring that detects your rest and your sleep. And above it, you'll actually see the reports that it generates. Think about how we can utilize some of this data. Maybe we use it in conjunction with medications. Maybe we use it before we prescribe medications. But there is so much available to us out there, and it is growing daily. We know on the lower left, you can actually see a really neat device. This is something that's about the size of, you can imagine a golf ball, but it's flat. And you would stick this on the patient's left shoulder. And what this would do is provide us with information on their heart rate, their respiratory rate, and their skin temperature. So if you have patients that are waiting in your emergency room to be seen, you could stick this on them so you have a little bit of a sense what's going on. We can put this on patients in their home. We can put this on patients in the hospital so that we have some monitoring capabilities. Over on the far lower right, you'll actually see a device that we can utilize to tell us if a patient needs to be repositioned so they don't develop a hospital-acquired pressure injury. These are all things that are out there and being utilized today. So I would encourage you to explore some of this. There's amazing technology out there. What's important for us to think about is as we digitally transform the way that healthcare is provided, nurses need to be at the forefront of this. We need to really understand what's the appropriate use case, when is the right time, who is the right patient, and making sure that we continue to provide safe and effective patient care. So it's on us. This is our responsibility to help pull these pieces together. That also means we get a seat at the table. We get to decide and be part of the decisions made in terms of what technology we're going to deploy and how we're going to use it. And in some organizations, they do a great job of inviting nurses in to help. Other organizations, not as much. So we really need to think about how do we communicate with our leaders? How do we communicate with our physicians? How do we communicate with our hospital leadership, our clinic leadership to let them know what technology is out there and how we can be involved in improving patient care with these processes? Now let's talk a little bit about education. The last couple years, we've seen a proliferation of virtual reality to help us educate clinicians, whether you're a nurse, whether you're a physician, whether you're a med student or a nursing student, we are seeing a tremendous amount of growth in virtual reality. I love this technology because what we're able to do is to create a variety of different scenarios, and then we can have not only students or residents, but also our existing staff go through these training scenarios over and over and over again. There's no real patients involved, so it really gives us a chance to get hands-on experience without impacting a patient. So think about how this really allows us to get better at ACLS or running codes or managing patient emergencies or managing difficult patients. This is the way that we can create scenarios and do it through automation or do it through technology. In the middle, you actually see a neat little screenshot, and this is the metaverse. There is a lot of work that is continuing to go on in the metaverse, and it's probably going to be several years before we get to the point of true utility. But the metaverse absolutely could be a place that we bring multiple different students or residents or clinicians together in the same place and allow them to interact at the same time around patient care or even around education, conferences and workshops and symposiums. So this continues to develop, and I think it's going to be fascinating to see where we go with the future there.